What we need now is leadership. Leaders who believe, leaders who have hope.
And that's exactly what the leaders gathered here tried to do, to look at ways to lead the world, especially countries in the tropics, out of the clutches of malaria and neglected tropical diseases, NTDs. The theme was unlocking the potential, ending malaria and NTDs to build a better world.
If there is one thing the pandemic has taught us, it is that together, through coordinated and collaborative action, we can achieve much more.
We know that this is a battle that is fought on the ground in local communities and by citizens themselves. In this regard, we acknowledge and give particular thanks for the tireless efforts of community health and prevention workers.
Several panel discussions included talk about building resilient healthcare systems by integration of efforts, the involvement of youth champions, the place of innovation and new tools, and especially access to innovation were raised.
On the benefits of integrating malaria and neglected tropical diseases, so the interventions, the resources, and how this will contribute to broader strengthening of health systems, which will then in turn be able to deliver services for all these diseases and for others, and bring us to a healthier and safer world.
The Kigali Declaration came with commitments from financial to tablets, as well as other healthcare products.
So for our part at the Gates Foundation, we're stepping up our commitment, and we're pledging $140 million over the next 4 years to support African institutions in fighting malaria.
Nigeria's President Muhammadu Buhari was represented by Health Minister Dr. Osagie Hanire, who participated in the earlier panel discussions and gave a picture of Nigeria's progress so far, some challenges, as well as appealed to participants to join efforts to make things much better.
I'm pleased to say my country has recorded gains in reducing the burden of malaria at NTDs and averting millions of malaria infections and deaths, as reported in the 2021 World Malaria Report. In spite of COVID-19-induced restrictions, Nigeria distributed over 17 million long-lasting insecticide-treated nets for vector control. LLIN prevents not only malaria, but also NTDs transmitted by mosquito vectors.
There may be a few areas where I believe we need to focus is, one, we have to focus on health promotion and disease prevention. That has to be at the center. And then for that to happen, building primary health care is important. So we should focus on building primary health care.
The one-day summit has come to an end with a declaration and commitments. And the Director General of the WHO says his organization proudly endorses the declaration, but challenged everyone to now go forth and walk the talk.